Turmeric Curcumin for seniors, joint pain relief plus side effects. Today I'm going to show you everything you must know so you can understand how turmeric curcumin is commonly used for joint comfort, what studies suggest about its benefits, and the side effects older adults should pay attention to. If you've been dealing with stiff or uncomfortable joints and want clear guidance within the next few minutes, this will help you make sense of what this supplement is actually known for. This video is for general informational purposes only and is not medical advice. Turmeric curcumin is widely known because many people use it to support joint mobility and overall comfort. Studies suggest that curcumin, the active compound in turmeric, may help ease general inflammation in the body, which is why people over 50 often explore it for day-to-day joint discomfort. It isn't a cure or a treatment, but rather something many individuals use as a part of a broader routine to feel more at ease when moving around. When you look at the supplement label, you'll usually see the amount of curcumin listed in milligrams. Some labels also highlight standardized extracts, which aim to provide a more consistent amount of the active compound. Another detail many people notice is the addition of black pepper extract, often added because studies suggest it may help the body absorb curcumin more effectively. These numbers simply reflect what manufacturers include or what clinical studies commonly test, not a recommendation for you. Your healthcare provider is the only one who can tell you what fits your personal health situation. For seniors, the biggest reason people explore turmeric curcumin is joint comfort. Some individuals say they feel more flexible or less tense after consistent use. Others use it because they want something that may support overall mobility as they stay active. While the results vary widely, many adults over 50 consider it because it's seen as a natural option that may complement other lifestyle habits. It's also important to understand the safety side. Although turmeric curcumin is generally considered well tolerated, some people report mild stomach discomfort, nausea, or increased bowel movements when they first try it. Because curcumin may influence how the body processes certain medications, especially blood thinners or drugs related to digestion, it's essential for anyone over 50 to speak with a healthcare provider before adding it to their routine. This is especially true if you manage long-term health conditions or take prescriptions daily. Product quality matters as well. Some supplements vary in potency, so many people look for brands that mention third-party testing or quality checks. This doesn't guarantee results, but it can help you understand how reliable the product may be. If you're unsure, bringing the bottle to your doctor and asking about any potential interactions can give you clarity and peace of mind. Turmeric curcumin may support joint comfort and mobility, but it's not a replacement for medical care. If you ever experience worsening joint pain or new symptoms, a healthcare professional can help determine what's actually going on. Use this information to guide conversations with your provider and to better understand what this supplement is commonly used for. Again, this video is for general informational purposes only and is not medical advice.